Hi there, thank you again for joining me. My name is Schweitzer-Morlan and this is a presentation on neurological advances in psychotherapy for Warner Pacific University. To begin the presentation, we will look at psychology and neurology and see how the two meet. Then we will move on to psychotherapy. Historically, mental processes were studied by psychologists, and the brain and the nervous system were studied by neurologists. Because psychotherapy tackles the mind and mental processes, it is believed by many that psychotherapy can actually influence neural architecture. Psychotherapy and neurosciences have recently converged, leading to the emergence of a newer model. Integration of psychotherapy and neuroscience has gained momentum in the last 2 decades. Neurologists throughout history focused mainly on the study of the brain, and psychologists studied the mind. With this, there was no meeting ground for the two, causing them to use their own methods of study as well as different language. But now today, psychology and neurology have merged to the study of neuropsychology, which is a branch of psychology concerned with how the brain and the rest of the nervous system influence a person's cognition and behaviors. Scientists in this branch of psychology often focus on how injuries or illnesses of the brain affect cognitive functions and behaviors. Next, we will look at how, if psychiatric disorders can debuild the brain, then psychotherapy can surely help in rebuilding it again. When we look more closely at the brain, we can see that the brain is not a predetermined or unchanging organ. Instead, the brain is an organ of adaptation. It can adapt to the demands and characteristics of a particular environment. Developmental neuroscience helps us to understand the process of how the brain is built and shaped by early experiences. Psychotherapy presents ways of rebuilding the brain. According to Eric Kandel, a famous American neuropsychiatrist, there are 5 basic foundations of neural basis of mental functions. Those 5 main principles have worked to help form the backbone of neurosciences in psychotherapy. The first one is all mental processes are neural, which means that all mental processes, even the most complex psychological processes, derive from operations of the brain. Number 2, genes and their proteins products determine neural connections. So genes and their proteins products are important in the pattern of interconnections between neurons in the brain and the details of their functioning. Number 3, experiences alter gene expression. Epigenetic influences alter the developmental trajectories. Altered genes do not by themselves explain all of the variances of a given major mental illness. Social or developmental factors can significantly contribute to this process as well. Number 4, learning changes neural connections. And lastly, number 5, psychotherapy changes gene expression. Psychotherapy produces long-term changes in behavior by producing changes in gene expression. So what does psychotherapy do to the brain? Psychotherapeutic techniques and processes can trigger or activate a series of functional alterations. The conditions created by psychotherapy support neural integration, regeneration, and new learning. When someone enters psychotherapy with the desire to feel better, they can often feel unsure how therapy will help them to accomplish this goal. So a common refrain from someone who is hesitant to enter into therapy might be, "How is talking going to help?" Because we as humans are used to talking to other people to get practical solutions to problems, and while problem solving does have a place in therapy, change also occurs on a much deeper and unconscious level. This process has to do with the way the human brain is programmed and cannot easily be mimicked outside of a relationship with a psychotherapist. Because our brains are always evolving unconsciously through relationships, people who experience painful relationships growing up have been trained to expect hurtful experiences with others. It takes a new type of relationship, in particular a therapeutic relationship, to retrain the brain to expect more positive experiences. Because psychotherapy produces such change in the brain, the therapeutic aspects occur not only during psychotherapy, but also in long-term situations, which leads to a lasting impact. According to the American Psychological Association, cognitive behavioral therapy, CBT, is a form of psychological treatment that has been demonstrated to be effective for a range of problems, including depression, anxiety disorders, alcohol and drug dependence issues, marital issues, eating disorders, and severe mental illness. Because CBT is goal-oriented, it works to change patterns of thinking or behavior that are often the reason behind people's difficulties. CBT aims to change the way that patients feel around various topics or issues. CBT works by changing people's attitudes and their behaviors by focusing on the thoughts, images, beliefs, and attitudes that are held, a person's cognitive processes, and how these processes relate to the way a person behaves as a way of dealing with emotional problems. Various research studies suggest that CBT can lead to significant improvement in functioning and quality of life. In many studies, CBT has been demonstrated to be as effective as or more effective than other forms of psychological therapy or psychiatric medications. So, can cognitive behavioral therapy change the brain? While various studies reviewed by professionals at the Journal of Neuropsychiatry and Clinical Neurosciences found that CBT is able to modify the dysfunctional neural activity related to anxiety disorders in patients who responded to treatment. Some of those include specific phobia disorder, social phobia disorder, obsessive-compulsive disorder, panic disorder, and post-traumatic stress disorder. And a quote here from the American Psychiatric Association, which indicates that CBT can actually change the brain by involving synapse changes. Quote, CBT favors the restriction of thought, modification of feelings and behaviors, and promotes new learning. Consequently, it involves synapse changes. The 20th century has been called the century of psychiatry, and in many ways we could also say the century of psychotherapy. So what does the future of psychotherapy hold? Will the advances in medicine, neuroscience, and psychology and our move into the digital age of social media render psychotherapy? These are all questions to be explored. Recent advances in psychopharmacology and neuroscience and evidence-based medicine have had dramatic impacts on the healthcare delivery systems and clinical psychiatry practice. But despite these changes in the field of mental health, psychotherapy still remains a crucial part of clinical psychiatry. Looking into the future of the field of mental health, cognitive behavioral therapy is assumed to be on the top of services planners' list because it's proven to be effective for a wide range of problems and thus already currently recommended by many professionals as the best treatment for anxiety, panic attacks, phobias, depression, anorexia nervosa, bulimia nervosa, binge eating disorder, obsessive-compulsive disorder, and post-traumatic stress disorder. CBT is time-limited and thus cost-effective, accessible, understandable, and acceptable for patients and convenient in that it can be delivered via a number of formats, including face-to-face, over the phone, online, and even guided self-help. A further advantage of CBT over other types of mental health treatments, including medications, is that it aims to help patients develop their own set of coping skills, both practical and psychological, so that they can, in a sense, become their own therapists. The consequence of this is that individuals are able to not only tackle and resolve their current difficulties, but they are equipped to deal with future ones, meaning that the results of CBT are long-lasting. Relapses are considered to be rare and usually only one course of treatment is needed. The future for cognitive behavioral therapy as a means for psychotherapy therefore looks bright. There has been a large surge in demand for this treatment in the management of more chronic conditions including pain, arthritis, insomnia, diabetes, heart disease, and even cancer. Moving forward, it is likely that CBT will be adopted to treat the whole range of physical and psychological ailments that plagues us. Thank you for watching.